Good day. You are on a video discussing the comparison of nutritional composition between Efione LivStrong Classic and Efione LivStrong Diabetes products. So we are comparing them to other meal replacements, adult milk brands in the market. So let's start with Efione LivStrong Classic. So by the way, I will not be going through all of the slides, especially the general information and the copy of the slides. If you check out the link in the description of this video, you can get a copy of the slides if you want to look at it further, or if you want to read the uh, details, the marketing details, and the general information. So we'll discuss the general information that's published by the products themselves. So, and then we'll move to macronutrients, vitamins, and minerals. So first is Nutribest. So Nutribest is from Unilab. Okay. They say they're a good source of whey protein, so that's their protein source. Fructooligosaccharides is a special kind of carbohydrate, and then gluten-free, lactose-free, fructose-free. So this is what Nutribest looks like. And then Ensure from Abbott. So they say they're the number one doctor recommended brand. And they are really, when you talk about meal replacements, you will hear Ensure. Okay. And then you have Nestle Optimum, the Boost Optimum. And they say they have 50% whey protein blend. So what's the other half of that? So contains probiotics, vanilla flavor. They also say they're halal certified. And then Entrasol from Calbee International, Pro Care formula, balanced macronutrients, and then vitamins and minerals. We'll see. And then lastly, our product is Efione LivStrong from Nutritech Enjoy, Taiwan. So I'll just read this because this is not yet published on the website. So we are a balanced and complete nutritional meal replacement designed for Asian metabolism. So that is actually the thrust of the manufacturing company. They manufacture many nutritional formulas really for clinical use. So LivStrong Classic is for their daily use for regular individuals with no special needs. So they also make formula for people who have respiratory disease, meaning that would have a lower carbohydrate percentage. They also make formulas for people on dialysis, people with CKD. They have supplement for people with cancer, and they have a lot of different formulas. But this is their most basic one. So 2 servings can provide your daily micronutrient needs, and 6 servings can provide 1,500 calories. And a lot of the patients in hospital of Nutritech enjoy using LivStrong Plus Classic can survive on just this for years. They've been using this for years, and then in the entire day, a lot of patients survive on just LivStrong Classic. And so caloric distribution is 53.5% carbs, protein is 16.4%, and fat is 30.1%. So it's highly bioavailable protein. It's 50% whey, 50% soy protein, 100% canola oil, which is high in monounsaturated fatty acids. It's 100% maltodextrin, no added sugar, 28 vitamins and minerals, including trace minerals. So minerals can sometimes be forgotten because we need them in very small amounts in the microgram counts. But being deficient in these really reflect on metabolism. And then it's an isotonic formula, meaning in terms of concentration, solute versus solvent, the amount of water uh, in the mixed formula. It's isotonics. It's the same with our bodies. So it will not cause GI dysfunction because sometimes if a formula is too concentrated, it will pull water and that will cause bloating. and stomach upsets. Okay, so this is Efione LivStrong. So for macronutrients, the standard split for adults is 60% carbs, 15% protein, and 25% fat. So that is our standard. That is regular. However, it's preferred that meal replacements derive more energy from fat because you want to contain your powdered formula. You want to contain energy in a smaller volume. All right, because to reduce bulk and at the same time increase satiety. So what are the factors that increase satiety, meaning the meaning of fullness, satisfaction, and what keeps you full for longer? Okay, that is protein, fiber, and fat. So increasing fat increases the satiety value of the product. So a higher fiber content might cause some discomfort and bloating to some patients. So because fiber holds water, and if a meal replacement product has very high fiber and it's given to patients who are sedentary, who are bedridden, or pre or post surgery patients, they're not gonna be moving a lot. So if there's a lot of fiber, then that can cause a lot of delay in how the formula passes through the intestines. And then last bullet, the standard protein intake of adults per day is 10 to 15% of total calories. So meal replacements can help supplement protein intake by providing 15 to 20% of calories per meal. So in regular for regular protein maintenance needs of adults, 10 to 15% is enough. All right? So higher than that is considered a high protein diet already. Okay. So uh serving size per gram in grams. So LivStrong is 57 grams per sachet. The Nutribest is also 57, Entrasol also 57. So hindi they are around the same amount. And then the calories per serving. So given these grams, calories per serving is around 255. Oh, there's Ensure has a lower calorie as well as Boost and Entrasol. So that's the lowest is 244 calories per serving from Boost, and LivStrong and Nutribest are on the higher side of calories per serving. So macro percentages, so 54, 16, 30. Nutribest is 51, 15, 34. Ensure is very high in terms of carbohydrate in the macro split. They follow the standard, but let's see how this will affect. Okay, so 60, 15, 25. Boost 49, 16, 35. So already higher in fat than LivStrong. Entrasol is 56, 20, 24, which is giving the highest amount of protein across all of these competitors. So in terms of osmolality, so again, the concentration of the formula. So LivStrong is 300 isotonic. So Nutribest is higher, 430. Ensure is the highest in terms of osmolality, is 534. Boost 340 and Entrasol 480. So Nutribest, Ensure being the highest, and Entrasol, which is around Nutribest and Ensure as well. This is a very high concentration. So what happens when patients or clients consume the product? So say, dissolve the powder in 250 ml of water. So when they consume this meal replacement, because it's very concentrated, it will pull the water from your body into the stomach, intestine area, and that can cause gastrointestinal upsets. Okay, it will be uncomfortable if you feel bloated because of water, and even us people, we know the feeling of being bloated, and it's not nice. And then protein source from Livestrong, it's 50% whey and 50% soy. Nutribest is 100% whey Ensure is 71% casein, 20% soy, 10% whey. Boost is 50% whey, 50% casein, 75% whey, 25% casein for Entrasol. All right, so for discussion, so again, the factors that contribute to increased satiety value is fiber, protein, and fat. So if products are higher in carbs, then they might have a weaker satiety value. And then again, fluid supplied with osmolarity above 300 milliosmoles per kilogram are hypertonic. They can cause delay in gastric emptying and cause fluid shifts in the body. And in terms of protein content, so whey is fast absorbing, soy is intermediate absorbing, and casein is slow absorbing. Okay. And when we are giving meal replacements, protein supplementation for people in disease conditions, or I mean, you want to consume here. So if you want your carbohydrates to be slower, all right, and you want your protein to be fast and intermediate. So it's good that LivStrong contains half whey, half soy. Okay. So elderly individuals would like to obtain greatest benefit with respect to stimulating muscle protein synthesis and muscle protein accretion by consuming a fast, leucine-rich dietary protein such as whey. Okay. And the consumption of whey protein stimulates skeletal muscle protein synthesis to a greater extent than casein or soy because whey is the fastest. And then you have soy. So what is the point of giving soy as an intermediate protein? Why not give just whey? Because you want for there to be an existence of amino acids in the blood serum for longer. Okay. So, okay, 50% you absorb this quickly, and then the other 50% is staying in blood serum for a longer period of time. All right. So the body will feel like, oh, there is protein available for a longer instead of just giving everything, and everything will be absorbed quickly. So macronutrients per 100 grams of formula. So we're now speaking in terms of 100 grams formula, okay? So per 100 grams, the energy calories for LivStrong is 447, Nutribest for 55, Ensure for 110, Boost for 144, Entrasol for 130. Okay. And then for total protein in grams, Entrasol is the highest, followed by Boost and LivStrong, and Nutribest at 16.5, and Ensure has the lowest total protein per 100 grams. Total fat in grams. So for LivStrong is 14.9, Nutribest 17, Ensure 11.5, which is the lowest among the five of them. Boost is also 17.5, so around 17, same as Nutribest. And Entrasol has 12 grams of fat per 100 grams of formula. And for saturated fat in grams, 2.7 for LivStrong, right? Because if you are using soy protein, there is saturated fat in soy protein. Nutribest 6.5, Ensure 4 grams, Boost 1.7, Entrasol 3.5. And for cholesterol, Boost reports 21 milligrams of cholesterol, and Ensure reports 5 milligrams of cholesterol. And it can be because they have casein, they have additional, so the milk protein in their product is higher. Okay, so you'll see the average calories per 100 grams is 437. And Ensure lowest protein. And then LivStrong and Boost the same amount of protein. Total fat, Ensure has the lowest amount of fat, which is again, fat is needed for satiety. And this is a meal replacement. So you want your patients not to feel hungry so soon. All right, saturated fat, Nutribest is the highest amount. Okay. So per 100 grams of formula, LivStrong contains 61 grams of total carbs. So Nutribest also at 61, Ensure also at 61. Boost is at 53, and Entrasol is at 59. So other than Boost being at 53, they're around at the 60 gram mark. For dietary fiber, LivStrong has 2 grams. Nutribest has 6.3 grams. Ensure has 3.4 grams. Boost has 5.6 grams. And Entrasol has 7 grams. And for sugar, LivStrong has the lowest amount of added sugar at 6.5. For Nutribest, it's 28 grams. So you see, if you can imagine a relationship between dietary fiber and so that's the slow carbs and sugars, that's the fast carbs. So even if this has a higher fiber content, it also has a high added sugar content. So Ensure 14.7 grams of sugar. So for Boost is 13.6 grams of sugar, and Entrasol 16 grams of sugar. So very high amounts of sugar for the other products. And again, these are the factors affecting osmolality. Again, the concentration of the product. So amount of electrolytes, type of carbohydrates. So again, fiber versus sugar, and the amount of carbohydrates in balance with protein and fat. So to review again the macro percentages, and given this amount of sugars, this now makes sense. The osmolality, the concentration. And this is why LivStrong is the best in terms of um, it being an isotonic formula. So this is really a good thing, especially if you're giving it to patients or to elderly. You don't want them to feel to have a GI upset. All right. So we move on to vitamins. So the considerations for vitamins is there are fat soluble vitamins. So and these are vitamins A, D, E, and K. So we need them in smaller amounts because our body stores fat. And if these vitamins are stored in fat, they come with fat and are stored in fat, then vitamins A, D, E, and K are not really needed in high amounts every day. So we shouldn't see them in formula in very high amounts. And on the other hand, water-soluble vitamins like vitamin C and the 8B complex vitamins, they are water-soluble. So we have them every day and they go out with our pee. Okay, they go out with water and water is excreted throughout the day, right? So they go out with the water. Okay, so these vitamins, vitamin C and B complex, they are the ones that are needed to be supplemented every day. So these are the vitamins and associated body functions. So for vitamin A, for eyes, immune system, skin, genes, and growth. Vitamin D, so it's formed in the skin. So vitamin D is also a hormone, other than being a vitamin, but it has to be activated by sun exposure. 15-minute sun exposure is needed every day. So early sun exposure to activate the vitamin D in the skin. So it works with the intestines, the kidneys, the bones. Vitamin E is an antioxidant. They are needed to create blood cells and they're stored in the liver. So vitamin K is for blood clotting. So if you have wounds, you don't want blood to keep on coming out. So the vitamin K helps with that. And for vitamin B, B1, energy metabolism. So the thing with the vitamin B complex, they are commonly known to help with energy metabolism, for DNA synthesis. So you will see their growth and reproduction and the neurological processes. So they really work a lot in maintaining and stimulating metabolic processes. So vitamin B5 for skin and hair, wound healing. And then vitamin B6 for nerve activity, blood formation, DNA. That's why you see vitamin B6 needed by pregnant women, right? because these these are the metabolic processes happening a lot in a young human, in a baby. And you have vitamin B7 for hair, nails, and skin, B9 for DNA synthesis, vitamin B12 for nerve activity. Right? They are also helpful in keeping our neurotransmitters healthy. Vitamin C is an antioxidant. So our body is when our body is done with its metabolic processes, free radicals are a natural waste product. So when our bodies are also subjected to higher amounts of stress, then we produce additional free radicals. And antioxidants are what neutralizes and sweeps away the free radicals so that the free radicals cannot age our cells. Okay? So free radicals are those molecules that stress out our healthy cells, making us age faster. That's why antioxidants are needed so that they're neutralized and they cannot attack our bodies. Okay, so people who look older than their age are those people who have more free radicals and are not consuming enough antioxidants. All right. So vitamin C, consuming foods high in vitamin C is helping with iron absorption. And vitamin C is well known for its role in the immune system. Then choline is an honorary member of the B complex vitamins, and they are in they are involved with nerve activity and gene expression. So choline is also well known for being in egg yolks. So sometimes dieters remove egg yolks from their scrambled eggs, and then you lose this amazing nutrient, so choline. All right. So for fat soluble vitamins per 100 grams of formula, and so for vitamin A, you will see that the RDAs in dark ochre, so these are all dark ochre, are from PDRI. So this is the Philippine Dietary Recommended Intakes. So this is the most updated for the Philippines. And the faded yellow standards are international standards, meaning there are no suggested amounts for these in the PDRI. So for vitamin A, Ensure gives 644 micrograms per serving. So why is that not good? So adults who consume more than 1,500 micrograms of vitamin A may develop osteoporosis. Then infants who are given excessive doses, 6,000 to 20,000 RE a day, may develop toxicity. So as a nutritionist, I am just concerned with when we talk about toxicity, I'm most concerned about vitamin A and iron because those two are stored in the liver. Okay. So birth defects occur in children of women with too much vitamin A, especially in the first trimester. And then mega doses of vitamin A again can cause liver toxicity. All right. For vitamin D, LivStrong 3.55, Nutribest 3 micrograms, 3.95, 3.25. Entrasol has the highest amount of vitamin D, and the standard is 5 micrograms. So for vitamin E, for male and female, it's both 10 milligrams per day. So you see, LivStrong gives 5.53, Nutribest gives 6.5, Ensure gives a whopping 18.5, and Boost, they really put this in their nutrition facts, and they are proud na that their vitamin E content is so very high. Like they say, more than 300%, I think 300% vitamin E needs. So they really put that. So what is the point of giving a standard recommendation if we are just gonna exceed it, right? Here, so relatively large amounts of vitamin E can occasionally cause muscle weakness, fatigue, nausea, and diarrhea. And the most significant risk is bleeding. Also, what vitamin E does is it pushes cytochrome P450. This is a molecule in the liver that really assesses everything that is taking into the body. So this is not good for people who have medications, because if you have too much vitamin E, and if you have a very let's say an over assertive CP450 in the liver, then you may be getting less active, you are getting less activity from the medications you're consuming. Okay, so especially for alkylating agents and anti-tumor antibiotics, anticoagulants, and antiplatelet drugs. Okay. All right. So for vitamin K, Entrasol contains 0 vitamin K. From LivStrong, it's 44.3 micrograms. Nutribest, 24 micrograms. Also 24 micrograms from Ensure, and then 26.5 from Boost. Okay, so for water-soluble vitamins, and let's show the standards here on the left. So for vitamin B1, the standard is 1.2 and 1.1. So per 100 grams, LivStrong gives 4.46, Nutribest 0.5, Ensure 0.7, Boost 0.4, Entrasol 0.53. And for vitamin B2, the standard is 1.3 and 1.1. So again, this is just from around 250 to 260 calories per day, right? That's the consumption. So how much does it give us? So for vitamin B6, 1.7, 1.6. So LivStrong, 0.54, 0.7, 1.9, 0.7. It's fine, all good. So for vitamin B12, the standard is 2.4. Ensure is giving more, and the standard is 2.6. And the Entrasol has 0 vitamin B12. And for pantothenic acid, which is 5 milligrams for the standard, LivStrong gives 1.85, Nutribest 3, 4, 2.4 for Boost, and Entrasol. So I want to remind you, the listener, that LivStrong is really proud of their formula being suited for Asian metabolism. So you can see what Ensure is doing. It's really ensuring. So let's give you the highest amount possible for some of the vitamins, some of the minerals. So however, sometimes if it's too much, it's also not needed for the body, because our body works through feedback loops. So if you give it too little of this, it will react this way. And then if you give too much, that is also added work for the body if you're giving too much of something. Okay. So Entrasol gives no vitamin B2 and vitamin B12. And then for other B complex vitamins, so for niacin, so standards is 16 and 14. All right, we're here. Ensure is giving again the highest, ensuring. All right, and then folic acid for 100 micrograms. It's 160, 127, 160. Boost is highest. There's a folic acid, and just all 211. And then for biotin, standard is 30. Again, Ensure is giving you too much of it. And then Entrasol is giving you none of it. And then vitamin C, the standard is 70 and 60. So Ensure at 54, 55, and 62. They are again giving you almost almost at the standard amount. And this is just for 1 meal. Okay. But again, this is vitamin C. So for me, this is the least threatening vitamin to give out in a high amount. However, if you're consuming really, really too much vitamin C, then your body, the moment you stop giving your body that amount, your body can interpret that as a deficiency. So you will get the white lines on your nails, or you get mouth sores or things like that, because coming from a high amount and then you suddenly stop. So that's what usually happens for vitamin C. So for choline, so 550 and 425 milligrams. So LivStrong gives 135. Nutribest, Boost, and Entrasol do not contain choline, and Ensure contains 108 milligrams. And so we move on to minerals. So the considerations for minerals. So you have macro minerals and trace minerals. So minerals occur in larger amounts because they have structural function in the body. So these are minerals you find in bones. These are the minerals which are electrolytes as well. You find in your blood and blood serum. So these include calcium, chlorine, magnesium, phosphorus, potassium, sodium, and sulfur. And trace minerals, equally essential, vital to the body, but in smaller amounts. So in micrograms. So to regulate metabolism as part of enzymes or other compounds, these are iron, manganese, copper, iodine, zinc, cobalt, fluoride, and selenium. So these are their associated body functions. For calcium, you find them in bones and teeth. So magnesium also with calcium in the bones, and for energy metabolism, also for movement of our muscles. So phosphorus, bones, teeth, energy metabolism, and genes. Potassium for nerve and muscle activity, and for regulating blood pressure. Chromium, this is known for helping with insulin activity and metabolizing starches and fats. So really, really well-known mineral for people with diabetes. Copper, they are involved with energy metabolism and blood formation. So in terms of blood formation, it helps the body recycle iron. So when red blood cells die after 120 days, we want to be able to keep the iron, and copper helps with that, with the recycling. And then fluorides for teeth and bones, iodine, thyroid function, irons for blood production, selenium is an antioxidant, and zinc is for gene expression and immune function. So we see supplements having vitamin C and zinc together in a capsule. So it's really for immune function. All right. So for sodium, we need to have less than 2,000 milligrams per day. So this is according to the American Heart Association. So usually, because we know that heart disease is the leading cause of death. So sodium, in terms of milligrams, LivStrong 373, Nutribest 300, Ensure 288, Boost 220, and Entrasol 280. Potassium should be greater than 3,500 milligrams per day. So if we're consuming a lot of sodium in our diet, we need more potassium. Because potassium, you find it in whole foods, in fresh produce. And as food gets more and more processed, you lose potassium in the process. So sodium tends to help increase blood pressure. Potassium helps dispose of the sodium. So hence bringing blood pressure down. So for LivStrong is 496, Nutribest gives 810, Ensure 600, Boost 560, Entrasol 460. And then for calcium, the standard is 750, higher for females at 800. So LivStrong gives 320, Nutribest gives 306, Ensure gives 450. All right. 450, Boost 270, Entrasol 390. So a doctor recently asked me if isn't it good for a product to be giving a lot of calcium, because we need calcium. You have osteoporosis, and a lot of people are calcium deficient. So the thing is, what happens is, when the patient is diagnosed as osteoporotic, they might be in their older age already. It's around 60, 70. So they have osteoporosis now because their bodies have aged. But guess what? Your kidneys all of their other um, organs have also aged. So if your body is unable to absorb and keep the calcium that you are giving it, so you're giving it very high amounts of calcium, of phosphorus, too much, if you're giving too much, then and you are not absorbing it, you are just giving your kidneys a lot of extra work. So that is not what you want to do. It's about consistency, not intensity, not giving it too much. So intensity is not always good, especially with nutrition. Here, so for phosphorus, that's standard is 700. So LivStrong 240, 285, Ensure 450, Boost 200, Entrasol 333. Magnesium standard is 240 and 210. So it's higher for men because men usually tend to have more muscle as well. And the magnesium is needed for movement, musculoskeletal movement. So LivStrong contains 110 milligrams. So for Nutribest is 137, Ensure 72, Boost lowest at 42, and Entrasol is at 79. All right. So for trace minerals, you have iron. The standard is 12 and 10. So LivStrong gives 4.61, Nutribest 6.5, 8, 3.7, and 3.5. And then for zinc, standard is 6.5 and 4.6. LivStrong gives 5.08. Nutribest gives 5.2, 3.5, 4.8, 6.4. And for the rest of the trace minerals, Entrasol does not provide them. So copper is 900 for both sexes. So LivStrong gives 610, Nutribest gives 660, Ensure 410, Boost 450. For manganese, standard is 2,300 and 1,800 micrograms. LivStrong gives 1,350, Nutribest 600, Ensure 1,300, and Boost 300. And iodine, 150 micrograms standard. LivStrong gives 46.8, Nutribest 35, Ensure 32, and Boost 37. And then even for selenium, chromium, molybdenum, and Entrasol does not provide these trace minerals. And so they're not really winning. So Entrasol, in my opinion, it's just to have a product, all right, we can say we're high protein, but in terms of it being having a good micronutrient complex, it's not really passing. And for selenium, so standard is 38 and 33. So LivStrong gives you 17.8, Nutribest 22, Ensure and Boost at 15. And then chromium, again, this is the one that helps with carbohydrate and insulin metabolism. So the standard is 35 and 25. LivStrong 27, Nutribest 36, Ensure 15, and Boost 8.7. So Nutribest is just a little high here. And then for molybdenum, standard is 45 micrograms. LivStrong gives 30, Nutribest 22, Ensure 30, and Boost at 21. There. All right. So I will be linking a video for the discussion on LivStrong diabetes, and because the slides discussing the considerations for macronutrients and the micronutrients, vitamins, and minerals have already been discussed. This will be more of a run through. So and please click the link in the description to lead you to the video for this next part. All right. So thank you for listening.